Good morning. Welcome back here at ESCMID Global TV. My name is Judith Cohen, and I have the great honor to introduce you to my next guest, who is live here with me in the studio here at the Congress Center in Vienna. And that is no one less than another keynote lecturer. I have with me here in the studio Fernanda Castro-Boulos, who will be holding her keynote with the title Defending Against Dengue, Global Epidemiology and Strategies for Prevention and Control. And this keynote lecture will be held today at 2:45, so 2:45 in Hall 1. So you're going to hear a little bit more about this keynote, and you'll probably be wanting to note down where you can follow the keynote live when you're here in Vienna, or if you're watching us from at home, you can log into the virtual program and follow the keynote lecture live at 2:45 in Hall 1. A warm welcome to you, Fernanda. Thank you so much for coming here to the ESCMID Global TV studio.
Thank you for having me. It's a pleasure being here.
Are you looking forward to your keynote lecture this afternoon? You are?
I'm a little bit nervous, but yeah.
Yeah, because it's great to have the opportunity, I can imagine, to speak to so many people about a topic so close to your heart, because you're focusing your research also on, and your work on dengue.
Absolutely. So I work for a public lab in Brazil. Yep. And it's pretty much focused on finding solutions for medical unmet needs in Brazil or in other developing countries that we know that although we had a lot of efforts in clinical research, sometimes that neglected diseases that we call the diseases that are more common in the South global, we usually don't see that much of efforts in terms of finding solutions. And then in Brazil, we have tons of endemic diseases that are in that neglected package, dengue being the principal one, I would say. So it's a pleasure to be here and sharing the thoughts about dengue, sharing how is dengue doing globally, and in Brazil specifically, and as well what we are doing to try to find solutions to prevent dengue. So I will be sharing also results of Butantan DV, which is a dengue vaccine that we are.
Yeah, because I read that dengue is a very common viral vector-borne disease. Can you tell us a little bit more? How common is this? Because in Brazil, it's more common than, for example, Northern Europe?
Absolutely, yeah. It's endemic in Brazil, but it's endemic in more than 100 countries globally. So when we see the global burden of the disease, I would say that we had more than almost 20 million of people that would, with dengue cases per year. We have around 4 billion people that are at risk of developing dengue, that meaning because they are living in an endemic country or because they are traveling to one. And this has a very high impact, social impact, economic impact as well. And with the climate changes and the warmings that we are seeing, we see a rise in dengue. Not only in endemic countries, but in cooler countries that are increasing the temperatures and at risk of having diseases in reports and etc. So it's becoming more and more global.
Yeah. What would you say is the biggest challenge with dengue for countries? Is it the healthcare consumption that comes with it, or is it survival, or is it what is the biggest problem that dengue forms for a country?
Yeah, I would say that the healthcare system is one of them. So in the dengue season, that is usually in the rainy time, in summer, in tropical countries, the healthcare system is really very impacted by the number of dengue cases. Fortunately, dengue, in the big majority, don't become a severe diseases, but we do have severe disease as well, and even some deaths caused by dengue. So there are a very important burden in the economic and the healthcare system, but also individually. And the challenge that we have is that we don't have effective mechanisms at this point to prevent or control the disease. So we need only to focus on mosquitoes, which is kind of, we're losing that battle. Yeah,
so prevention and control. So prevention, well, we'll be talking a little bit later about that. I'm assuming you're also referring to vaccines, for example. But controlling the disease, what kind of treatment options are there? Are there treatment options?
There are no specific treatments, just supportive care. So hydration and symptomatics. So even for severe dengue, we don't have any specific treatments at this point. We do also have treatments in development, but no approved treatments for dengue.
Okay. That's a problem.
It is.
Yeah. Which is why you're probably working harder also on preventing the disease, of course. So what is the situation around vaccines for dengue?
So we have already 2 vaccines that were developed and approved. One of them, you depend on doing a test prior to receiving the vaccine, because only folks that have been exposed to dengue before are eligible. So that makes very hard to be used.
What type of vaccine is that?
It is, all of them are live attenuated tetravalent vaccines. That's pretty much how we are trying to tackle dengue.
Yep.
One of the challenges that we have is that dengue has 4 serotypes, and the vaccine needs to be effective against the 4 of them. Otherwise, you can even put the individual at risk.
Yep.
So that's a big challenge that we are facing. And then the second vaccine that was already approved, and it is being used in Brazil, but the challenge in there is the scale. So, for example, we have 200 million people in Brazil. And in the last year, we're able to vaccinate maybe 5 million with the vaccine. The availability of the vaccine, the challenge in there. And then there is really a lack of...
What is the largest hurdle for making it available? Is it money, or is it...
I think that is scaling up the manufacturing process. Okay, yeah. So I think the manufacturers are looking on solutions to scale that up. It's not an easy vaccine to produce because of the 4 serotypes. All of them are different serotypes, so it's hard. But also you need to have focus on where it is endemic, and there are other places in the country besides Brazil, as the Southeast Asia, where dengue is also endemic, and there is also a need, so a global company needs to look to different countries.
Because they have different serotypes in different regions?
Different seasons, and even sometimes different serotypes circulating.
Yeah, so potentially in different countries or different regions of the world, you may need not tetravalent, but...
No, you always need tetravalent.
Decavalent, no? Oh, no, but even more serotypes, or?
If we identify new serotypes, definitely, they will need to be included in the vaccine.
4.
But at least 4.
Coverage.
At least 4.
Yeah, yeah. Okay, and do you experience, well, in your country, a gap between the science and the policymakers, that do they feel the need to vaccinate against a disease like dengue?
Absolutely, yeah. In Brazil specifically, we have a public healthcare system that is universal, so that's for the entire population. And the National Immunization Program, which is in the public system as well, is very effective on incorporating the vaccines that are important, epidemiologically speaking. And they are looking forward to dengue. So Butantan, being a Brazilian public lab, we are kind of part of this ecosystem. So we have very open conversations with the regulators and with MOH, for example, and we know they are looking forward to have that vaccine to be incorporated, and they will consume as many as we can produce until we have the entire population, or the entire eligible population, vaccinated. Yeah. Yeah. But we do also have the knowledge that it's not that easy in some other countries, mainly when you need to choose in which vaccine you're going to incorporate, or if in places where dengue is not as obvious as a healthcare problem as it is in Brazil, then you need to make decisions. But I think that for Brazil, this may be priority number 1.
Yeah. Do you also encounter problems with, because I just heard you mention that you only have efficacy of the vaccine if you've already been exposed to dengue before, so you've been sick before, right?
That's for another vaccine.
Okay.
Yeah,
okay.
Yeah. For the current that we are using in Brazil, and for the one that we are seeking approval, you can receive either way,
naive.
With or without prior exposure to dengue.
Yeah. Yeah, because was it a problem with the first vaccine then, that people weren't willing? I mean, they survived the first bout of the disease. Yeah.
And sometimes you need to be tested, because dengue is also an asymptomatic disease in a lot of cases. So we do have tons of symptomatic dengue. That's the cases that we actually identify, but we do know there is a lot of asymptomatic disease. So although the high numbers, we still have underdiagnosis.
Is it relevant to vaccinate people with asymptomatic? It
is. It is
so
relevant.
You need to do it population-wide.
Population-wise, because we need to decrease infectivity.
Exactly.
It's not only in terms of the individual protection, but as well as reducing the virus load on the mosquito. So the mosquito, it can infect less and less people. So if you're reducing significantly the infectivity on the sick people, even though they are asymptomatic, we are closer to trying to mitigate dengue impact.
Yeah. So in your keynote, what will your main focus be? Will you be talking about all these topics that we were just touching on, or are there more important, or what is your key message? Could you tell that?
I think that one of the key messages that I want to convey today is that the fact that dengue is becoming more and more global. So we need all to be our eyes wide open because it is very quick. So just to give you an example, up to the 80s, we didn't have dengue in Brazil. Now, less than 50 years later, we have the biggest healthcare problem in Brazil, with the dengue being endemic in all the regions of Brazil and not sparing, any places. So it is very quick, and with the warming, it is becoming globally faster than we would be expecting. So I think that we all need to be focusing on solutions before it keeps being endemic in more and more countries, keeps spreading. And the second one, it is that, we need to start working right now on strategies for preventing and controlling, developing vaccines, developing specific treatments, because they take a long time to be ready, and we want to be ready prior to that, uncontrolled spread of the virus.
Yeah, so you're saying that the concern is this will become global if we don't all join hands and fight against this.
Exactly. Yeah. It shouldn't be a problem
just in Latin America.
Only where dengue is already endemic. It should be a problem of all of us.
We need to start thinking about it.
Absolutely.
Well, what better place to start thinking than a keynote lecture? Yeah. Thank you so much for taking the effort and time to come here into our TV studio to explain to our viewers what you will be talking about this afternoon at 2:45 in Hall 1. Please make sure, if you have the time, to join Fernanda Boulos in her keynote lecture, because I think that will be really interesting, and we need to start thinking about dengue wherever you're from. Thank you so much for watching us here at ESCMID Global TV. We will be back at 12 o'clock today with yet another interview with a keynote lecturer. So I hope you'll join me then, and then we can hear some more interesting things. See you then.